Melanoma is a serious form of skin cancer that develops from melanocytes, the cells responsible for producing the pigment melanin, which gives skin its color. It is known for its potential to spread to other parts of the body and metastasize more than other types of skin cancer, making early detection and treatment crucial. Overview incidence: melanoma is less common than other skin cancers but is more aggressive and can be fatal if not treated early. Risk factors: ultraviolet UV radiation. Excessive exposure to UV radiation from the sun or tanning beds increases the risk. Fair skin. Individuals with lighter skin, freckles, or red or blonde hair are at higher risk. Family history. The family history of melanoma or other skin cancers increases risk. Presence of moles. Having many moles or atypical moles dysplastic nevi can increase risk. Weakened immune system. Individuals with compromised immune systems are at higher risk. Symptoms: melanoma can appear anywhere on the body, often in the form of a new mole or changes to an existing mole. Key features to look for include: face symmetry. One half of the mole or spot does not match the other. Borders. The edges are irregular, ragged, or blurred. Color. The color is not uniform and may include shades of brown, black, tan, red, white, or blue. Diameter. The spot is larger than 6 mm, about the size of a pencil eraser, although melanomas can be smaller when diagnosed. Evolving. The mole or spot is changing in size, shape, or color over time. Other symptoms may include itching, tenderness, or bleeding in the affected area. Diagnosis of melanoma typically involves the following steps. Physical examination. Healthcare provider examines the skin for unusual moles or spots. Dermatoscopy. A special magnifying device dermatoscope is used to examine moles more closely. Biopsy. If melanoma is suspected, a biopsy is performed to remove part or all of the mole for pathological examination. Types of biopsies include: excisional biopsy, removal of the entire mole or lesion. Incisional biopsy, removal of a portion of the mole or lesion. Shave biopsy, a thin slice of skin is removed. Staging. If melanoma is diagnosed, further tests may be conducted to determine its stage, which includes sentinel lymph node biopsy, to check if cancer has spread to nearby lymph nodes. Imaging tests, such as CT scans, MRI, or PET scans to assess if the cancer has metastasized. Treatment options for melanoma depend on the stage of the disease, the thickness of the tumor, and other factors. Common treatments include surgery. The primary treatment for melanoma is surgical removal of the tumor. This may involve wide excision, removing the melanoma along with some surrounding healthy tissue. Lymph node dissection, removal of nearby lymph nodes if melanoma has spread. Adjuvant therapy. Additional treatments may be recommended after surgery to reduce the risk of recurrence, including immunotherapy, medications that stimulate the immune system to fight cancer, such as checkpoint inhibitors e.g., pembrolizumab, nivolumab. Targeted therapy. For melanomas with specific genetic mutations e.g., BRAF targeted drugs e.g., vemurafenib, dabrafenib may be used. Chemotherapy, less commonly used for melanoma but may be considered in advanced cases. Radiation therapy, used in specific cases, such as when melanoma has spread to the brain or for palliation. Prognosis. The prognosis for melanoma largely depends on the stage at diagnosis. Early stage in situ or localized high cure rates with appropriate surgical treatment. Regional stage. The prognosis is still favorable, but it may require more aggressive treatment. Distant metastasis. Prognosis is more guarded, but advances in immunotherapy and targeted therapy have improved outcomes for advanced melanoma patients. Prevention. Preventing melanoma involves reducing UV exposure and monitoring skin health. Sun protection. Use sunscreen with at least SPF 30, applying it generously and reapplying regularly. Wear protective clothing, hats, and sunglasses. Seek shade, especially during peak sun hours 10 a.m. to 4 p.m. Avoid tanning beds. These increase the risk of developing melanoma and other skin cancers. Regular skin checks. Perform self-examinations and have regular check-ups with a dermatologist to monitor moles and skin changes. Conclusion: melanoma is a serious form of skin cancer with the potential for aggressive behavior. Early detection is key to effective treatment and improved outcomes. Individuals at higher risk should engage in regular skin screenings and practice sun safety to reduce their risk of developing melanoma. If any changes in the skin or moles are noticed, it is important to seek medical evaluation promptly.